speaking of things that used to be very popular, that used to be very popular, and we all trained learning how to do it. And before free flaps were popular, that's what people did for breast reconstruction, and I have seen and done and had beautiful results with that. The scar hides very nicely in the bra line in the back. It takes the back fat, which most people have, and that gets pinched out with the underlying muscle to come forward and offer muscle for that sling that has a protection and support of the implant, and then also a little bit more skin if needed to resurface the external part.
And that's a great option for lumpectomy defects. So patients who have already had a lumpectomy radiation have significant puckering of, sometimes their nipple can be puckered way to one side, they can have puckering upwards. The latissimus can be a really great option in that setting if the patient does not want a mastectomy, but they have all that radiation, to just add a little bit of tissue through a relatively simple technique.
I've found that to be very challenging when I see patients who've had a prior lumpectomy and they've had radiation, and then over time that seroma cavity where the breast had the lumpectomy fills up with fluid. So at first it looks okay, then they have radiation, and as they heal over time, that little cavity of fluid kind of shrinks down into a hard little nodule. Sometimes it's painful, and sometimes there's a dent. I have not had experience with placing a latissimus to fill that space. Would you go back for that patient and remove that scar pocket and then sneak it in through a little tunnel, or how do you approach that?
Yeah, I just had a recent patient who had a lot of nipple elevation. So it was sitting, I think, almost like 8 centimeters higher than the other one and was visible in clothing. And so we just released it. It didn't look like there was a big defect. By the time I released all the scar tissue, I had a 13 by 13 centimeter area of dead space. And yeah, I just tunneled the latissimus, it filled in that hole and lowered the implant. It comes at the cost of scarring and a visible skin patch, but it's always a trade-off.
And scars can be faded to some
Scars can be
degree
well
with
managed,
time.
yeah.
Laser treatment, silicone sheeting. There's a lot of ways to go to help patients heal well.